Hi, my name is Elizabeth,
And I'm Taylor.
and we are doing our presentation on an emerging technology called digital intraoral scanning.
Okay, so you're probably wondering what is digital intraoral scanning. So what it is it's a new device used in dentistry, and it's used to capture impressions. So rather than the traditional with the trays and the alginate, now we have this. So what it does is you use this little wand and it forecasts a light onto the area or tooth being scanned, and then it is captured by imaging sensors, and it's processed into the computer by a special software, and it actually produces a 3D model.
Yes, and in addition to that, like Taylor was saying, the 3D model is great for patient record keeping, which is a fundamental aspect of dentistry because you want the patient to have comprehensive care. Accurate information entails invaluable data of medical records, diagnostic information, similar to radiographic images. You want that to help with treatment planning and the doctor to diagnose thoroughly and properly.
Okay, so also, how would you use this scanner? So when your patient comes in, you just lay them back like a normal exam, and then you will have this, what I'll call a wand, that in the photo that she's holding, you're going to go ahead and put that in the patient's mouth, and then you will slowly move the wand around over the tooth surface, and it's going to basically copy it with the sensors transferred to the computer through the special software I was just telling you about, make the 3D image. And what's really cool about this is that there's a way you can enlarge the image or you can manipulate it, and it's really nice for dentists, especially if they want to enhance detail, and they can use it during restorative work if they want to see something very specific that they're trying to work on. Okay, so now we're going to talk about why and when we would use this. So as you can see in both of the pictures, so the first one for orthodontics, it can be used on aligners, braces, retainers, any of that, and it could really help with um, the orthodontic side of dentistry. And then also restorations. It's huge in this side. It can be used for crowns, veneers, bridge work, and implants. As you can see in the lower picture, they actually manipulated it like I talked about. They zoomed in and they can see more specific things that they're looking for. Also preventative, like night guards, they can use this device for.
Yes. And also, additionally, it is very useful in dental hygiene. For example, it's great to progress and track the dentition of a patient. Um, And also, if the clinician, dental hygienist, has extra time, he or she can see flattened incisal edges, and noting that instead of asking the doctor who's busy, they can just go ahead and scan, in case they are in need of a night guard. So it helps with time efficiency as well in dental hygiene. And here we wanted to show a video of actual digital intraoral scanning. So I'm going to play it for you. So a great ending message, of course. In the video, they did use one of the intraoral scanning models, but there are a couple out there now in the market. Okay, moving on. We're going to talk about the disadvantages of digital intraoral scanning. One of the first cons that we can think of is the initial financial expenses. The upfront costs can range from $15,000 to $50,000. So that is a big chunk of money that usually smaller dental offices would have trouble doing because they are trying to figure out, is it worth it? And alongside of that, you do have the managing costs. So you have the initial cost of the machine itself, the software, and any like backup systems, storage files, etc. And then in addition to that, it's the managing costs. So if you need updates with the software along the way, that can be costly as well. And if anything happens, it can be expensive to repair. So you do want, a staff and a team that will be careful of these expensive technologies. Um, and also, there is a learning curve to intraoral scanning. Typically speaking, clinicians that work well with technology and usually they're younger, it will be easier for them. But clinicians that are of older generation, um, they are more comfortable and they're more of a higher expertise level with the traditional conventional impression route. So there may be some pushback with staff. And lastly, there may be difficulty in detecting deep marginal lines. Um, when the doctor is doing restorative work, for example, he is crown prepping, and that patient may easily bleed. And with the bleeding, that will hinder the intraoral scanner to capture the necessary structures that it needs to in order to have a properly fitted crown. So some advantages, there's actually a lot of advantages to digital impressions, one being patient comfort. So being able to provide a comfortable setting for your patient is very important to build that rapport and also for patient retentiveness. And you are alleviating the other materials like alginate and the big metal or plastic impression trays. So they don't have a mouthful of just stuff in their mouth, which can cause some pain even. There was a study that used young orthodontic patients. I believe this is in Turkey. And basically, the study said that they preferred the digital impressions over conventional impressions because they stated that the conventional impressions with alginate made them queasy and it was just uncomfortable. In addition to that, it's more time efficient. With traditional impressions, you have to pour the stone cast, obtain the plaster model, and then send the models out to the dental laboratory. Um, and that would take probably a week or two. So that can be a bit time consuming. But when you're scanning, you scan the patient to completeness and then you're able to send the file right away to the dental laboratory or to other providers if you're doing something else. And then while you're in contact with whoever you're sending it to, they can tell you if it is sufficient enough and accurate to continue with the treatment. If not, the patient's already there in the chair. You don't have to schedule a second appointment, and it saves the office time and the dental laboratory and the patient. So, it's a win win for all. It's also a simplified procedure for the clinician because you can just recapture the impression. You don't have to remix the alginate impression. You don't have to get a new metal tray. You don't have to get the wax, to make it comfortable for the patient. You can just rescan them, and it's as easy as that with just that equipment. Some other advantages include long-term cost savings. So if you're thinking about it from a long-term standpoint, you will be saving money. Um, because you're not having to buy the materials as much, like alginate impression trays, and you're not having to pay the extra lab cost that comes with the fabrication and shipping fees. If the doctor ships his crowns or his restorative work to the other side of the country, that can add up with shipping. So in addition to that, you have more money for the office and you have more time to schedule more patients. Some other advantages include better communication. So this is very important, and it also reflects the field of dental hygiene, because the patient is able to see the impression visually. And with this, they are more inclined to be more involved with their dental treatment. It's a positive outcome because this will establish that conversation of patient education. Um, and then while you're showing them the image of their teeth and how it can shift and any concerns, they'll be asking questions. And then that will create a very strong rapport with your patients. Alongside that, patients will rave about you, they'll rave about the new technology in dentistry, and that alone in itself will be a great marketing technique for dental offices. Overall, the digital intraoral scanners affects greatly on dental hygiene in a very positive way. The emergence of this digitized dentistry has made advancements for dental hygienists, because in the field of dental hygiene specifically, intraoral scanners, it promotes patient education, consistent data assessments, and effective communication. Um, with the data assessments, you are able to see the progression and progress of a patient's dentition along with their oral hygiene, and it makes, it keeps them accountable. And like I said before, it creates that effective communication between the patient, but also the providers. Amongst the providers, we want to highlight the importance of interprofessionalism in healthcare. So within dentistry, there's many different specialties that you want to communicate with and build that strong rapport with. So then you can give that patient a comprehensive patient care.